Good day, everyone. Um, my name is Azima, and I'm a 19-year-old woman who resides in Niger State, northern Nigeria, and I will be discussing on painful periods with Apropos Doctor on this documentary. Stay with me. First of all, I'd like to say it's a privilege to be able to discuss on this topic, painful periods, which is something that I think almost everyone has randomly spoken about, either casually or in a serious conversation, regardless of whether you're a boy or a girl, in one way or another. So to be able to say this and contribute to it, say my bit, and hopefully making it resonate with at least one person, a woman out there who needs to hear it, is something that is a big deal. Um, Dysmenorrhea, which is the medical word for painful periods, like it entails literally painful periods, pain during menses. Before I start to really talk about this wholly in depth, I would love to mention that pain is unique. Pain is subjective. So my definition of pain might not be someone else's definition, will definitely not be someone else's definition. Pain differs, even between people who live in the same house, between people who were born of the same womb, even between twin sisters or brothers. Threshold for pain will differ among different ethnicities, different cultures, different backgrounds. Pain is subjective. In layman terms, the thing wey go pain me fit not pain another person. Meaning, what I might consider as painful might not be at all paining or painful to the other, to someone else, right? And this is because we all have different backgrounds, like I said, and many other factors that can contribute to this, like even society as a whole, a major factor. Say in African societies, uh, I would just love to simply say we tend to have higher tolerance than our fellow age groups in, say, European societies. No offense to Caucasian fellows, but this is just, I think, a simple truth, arguably. So, my story with painful periods. Painful periods for me was something that I discovered, or should I say, something that I had when I was diagnosed with PCOS. So, yes, during the course of this video, I will talk about PCOS a lot. Maybe not a lot, but somewhat, because it was when I was diagnosed with PCOS that I realized that painful periods is a thing. That was when I had dysmenorrhea. So a little backstory. I started menstruating very early. It was during my JSS3 holiday break. For those who are familiar with the schooling system in Nigeria, I was, how old was I? Yes, I was 11 years old in JS3. Yes, I was. So I started menstruating before the age of 12, basically. Was 11 years and some months old when I started menstruating. And menses was okay. In fact, There was no pain. I remember clearly the first day that I started menstruating. There was no pain at all. I had this silly mood swings. Now that I look back at it in retrospect, I think that's something that every teenager, had at some point. Everyone watching puberty had those mood swings. So yes, other than the silly mood swings, crankiness, stubbornness that I think I kind of developed prior to starting menstruation, there was no pain at all, genuinely. So, um, I started menstruating. There was no pain. There was no complaints. I just saw the blood. In fact, I didn't tell my mom that day. Um, until days after she figured out before I told her, and I got a good scolding for it. But anyways, it was fair and good and all of that. No problem at all. I think I use like 3 to 4 pads daily. I think about, yeah, 3 to 4 pads daily. Like I said, there was no issues at all. My mom even asked, God, like I said, I was so young at the time again. So she was concerned that it was early for me, given that she said she started menstruating at a very late age. Not too late, but in our late teens compared to me, who started very early, and I'm the firstborn. So she was a bit bothered. But I think she probably spoke to a few of her colleagues about it, and then she tried not to make me, she tried not to make it obvious to me that she was bothered, but I reckon she was. So yes, I menstruated that month, the month after, continuously like that. The first few months were okay, like I said, until after about, was it 6 months? And I noticed that actually it started with what is medically known as oligomenorrhea. Oligo is medical term for small, menorrhea, menstrual flow. So forgive my use of medical terms. I'm a medical student. So yes, um, yeah, there was reduction in the rate of the menses. Like normally, I usually use like 3 to 4 pads a day. So I see that when I go to change my pad, there's just not much blood, just like 1 dot, 2 dots. But again, my mom literally told me that you shouldn't wear a pad for more than 6 to 7 hours. 7 hours is too much. After 6 hours, whether it's blood full or not blood full, change the pad. Blah blah blah. So yes, that was the first thing I noticed. And then eventually, instead of the normal, was it instead of the normal 4 days, it would come for just 2 days or 3 days. And then later, I stopped seeing my period completely. Now, all this while it was, you know, even this telltale signs like not coming for 4 days, not using up to 4 pads in a day, I did not tell my mom. I didn't know that she was, taking note, like observing, even though she shouldn't say anything about it. Until I didn't see it at all for like 2 months. And then I was panicked. I panicked really because I did not have a boyfriend. I was too young. I was really young. So I was like, what's happening? I think I'm pregnant. But I know I could not be pregnant because there was no man, there was no boy at the time. So, sure, I told my mom, and she was like, I know. Thank God you have finally decided to tell me. So now let's go and see a doctor. And then she said we're going to see a gynecologist. Um, okay, here's where it gets interesting. The first doctor she took me to see, a male doctor, by the way. I don't know, Sha, but let's go. Let's get going. The first doctor she took me to see. a male doctor. Um, I did not like him at all. Maybe it was the way he spoke. Maybe it was the nonchalance with which he spoke. Maybe it was because he addressed me like I was very little. Of course, I was a small child, but he addressed me like he didn't even address me. He addressed my mom. So yes, I did not like the man at all. It was and it's like was it sure I know in his middle ages, you know, like between that 30, 40. Can't really say, but yes, was a quite young doctor. Um my mom could sense that I didn't like the man at all. And what pissed me off the most, he mentioned that, oh, I'm fat now, so all these things happen, especially when a child is overweight. I won't lie, I was pretty overweight growing up. Looking at it now in retrospect, I was overweight growing up. I was a very chubby kid, bigger than most of our peers. Yep, tall, big. So, yeah, the chubby one. So he just advised that I should just lose some weight, some fat. But to come back, we should not worry. Let's see how it goes again. Before we start getting bothered, I should not get mommy worked up. Let me just stop eating. Let's see. After I lose some weight, I'll say everything will be back to normal. Yes, yes, yes. Sure, it seemed as though even my mommy did not really like how we acted. So, fast forward, a few weeks later, we went to see a consultant gynecologist. He was a practicing doctor. He is a practicing doctor here in Niger State, which is where I reside, and he co-runs a private clinic. So my mom took me to see him at his private clinic, and when we went there, he's a quite older man. I should say 55 plus, say 60. Let's just keep it 55 plus. So went to see him. He was very nice with his words. He was kind. He addressed me. He didn't address my mom. It made me feel like, yes, I'm the patient. You know, when you go to see someone, regardless whether you're big or you're small, and then they're like, okay, yes, when they focus on you, right? He asked me how I felt, he asked me a lot of questions. Did my periods usually come late? Does it hurt? All of those things. And I was like, I'm like, okay, all right. In fact, he just spoke to my mom briefly, and then I was sitting facing him, and he focused on me, as it should be. Anyways, he finished speaking with me, and then he said, all right, now, mommy. So he was now addressing my mom and myself that he's not sure yet, but given all the history that he has taken, it will be disserting. His dissertation was PCOS. However, I am pretty much very young, so it's not completely sure. Also, from the history he took, he did mention that I was really stressed out from school, which is true because I attended a federal unity school at the time, left home very early, around past 5, got back home in the evening around past 6. So, yes, secondary school was definitely a lot, and I was very smart. Anyways, yeah, just a little backstory there again. So it was like, okay, stress levels plus I think we should also try on losing some weight and see And the way he said that was different from the person who called me fat and said that could be why. They're two different things. I can't really remember exactly how either of them said those things in addressing my weight. But I want to mention that the second doctor, first of all, addressed me as a human being, made me feel seen. More like when you address a child as though they are whole and respectfully, with the same respect you would accord an adult. So that child really feels seen and dignified in a way. So even when you talk about vulnerable things or things that the child has esteem issues with, the child feels comfortable with you somewhat because you have already initiated a kind of, should I say, relationship, a good start, if that makes sense. So the second doctor was really kind. For me, I think there's a difference between nice and kind. Personally, I think anybody can play nice, but not everybody can act kind. So the second doctor was really kind, not just with his actions, but even with his words. Everything about him was calming and soothing. So I felt comfortable. I didn't feel like I was speaking to an adult. It made me feel like, oh, we're just two people talking about me, So it was, I can remember very clearly, it was calming. In fact, my mom was like the third wheel. That thing they say about three is a crowd. Yeah, she was the crowd there. It's like me and the man were in a relationship, and my mom was just the outsider there, just sit there and looking at us as we deal with one another. So that was just basically what it felt like. Um, so there was no medications, no tests again at the time. It was like, how about we just try, you know, to lessen our stress levels and be more active. We can even start with just daily jogging or just weekend long walks. Till today, I love walks. I really love long walks. But, anyways, that's not the topic. Let me not deviate. So that was it. Um, went home, tried to lessen my stress levels. Another thing he spoke about when we were speaking about my weight was my eating habits. Like I said, I attended a federal unity school. For those who have, well, I don't know about now, but then it was quite stressful. So simply put, it was grueling trying to eat at the right time. I was not a breakfast person at all until I had ulcer, but I was not a breakfast person. So I do not like to take breakfast at home no matter how much my mom would force me to. So I'll just pack my food to go. And this affected me without me even knowing then. Because I don't take breakfast. I'll eat lunch. Well, something before lunch. Around, I think our break time in school was 11 something. So I'll eat like half of my food then, eat the remaining one during the long break, which was around 2 o'clock in school. And then I'll get back home in the evening around 6. And then I'll be very hungry when I get home. So when I get home, I usually eat ravenously. So my dinners were usually very heavy. I knew that. Like I can remember I usually eat a lot at night, especially if it's rice or pasta. So I'll eat like triple of what everyone else is having. And at the time, even though my mom complains sometimes, she'll be like, well, okay, you're growing, Sha. You're at that age. But when we spoke about it in the hospital, we're not like, okay. you would have to be packing extra food to go. So I'll be able to space, you know, I'll be able to have something else after lunch, like a snack or backup meal before I get home. So when I get home, I won't be overly hungry. So we began to do that. I wouldn't say I did not noted whether it made a difference or not. But looking at it again now in retrospect, I think it did make a big difference somewhat. And so yes, also started the jogging thing. I don't think I was really consistent with it, but I tried anyways. Fast forward, okay, after that, my period did come, like miraculously, I think the following month. It came for like 2, 3 months and then it ceased again. And then we went back. So we went back to the doctor and it was like, oh, okay. Um, now we'll do some weight. By the way, in every appointment of his, it takes my I climb uh what do they call that then again? I climbed uh that thing that they used to measure somebody's weight. Yes. Oh god. Yes. I climb on it. And my weight is being measured for every appointment. So I think by that appointment, the third one was it the second one? Yeah, the second appointment with this gynecologist, consultant gynecologist. It was noted that I had lost about 3 kg. So I was like, okay, okay. Just again, more info. Um, yes. And then we did some, okay, we didn't do a test. It was an ultrasound. Yes, that thing that they put, yes, where they put the globe of jelly on your belly, and then they use a probe to maneuver around your abdomen to see your internal organs. Simply put, simple English, they shall check us inside, take a picture of what's happening inside. For those of you who have been pregnant before and have gone for routine pregnancy ultrasounds, you'd understand what I'm talking about. So, yes, that was exactly what I did, an abdominal pelvic ultrasound. So, during the ultrasound, after the ultrasound, rather, he inferred that I had ovarian cysts, multiple ovarian cysts. And he also noted that that my endometrium was engorged with blood, endometrial hyperplasia, and ovarian cysts. So that was the diagnosis. So the diagnosis in whole, the assessment was polycystic ovarian syndrome, PCOS, or what some people call PCOD, where the D is disease, but right, I'm used to hearing it being referred to as PCOS. Um, when some people hear PCOS, I don't know, they freak out. They be like, that thing that women have that make them not be able to get pregnant. I have literally heard someone refer to it as that. And I felt embarrassed on that person's behalf. Maybe old me would have felt hurt and small, but not anymore. Um, PCOS is not something to be ashamed of, nor is it something to shy about or away from. It's not something to be embarrassed about, basically. Yes, it's it's a type of hormonal imbalance. Simply, it's a type of hormonal imbalance where a certain hormone, amongst the hormones that is produced in the woman's body, there's an imbalance. Simply put, that's the best way to describe it. So, normally in women, estrogen and progesterone are the major hormones. There are lots more of other hormones, but estrogen and progesterone are the two major ones. And in men, the major hormones are collectively known as androgens, which the most popular one that people know about is the testosterone, right? So the like major one in men. When I say men, I mean guys that have hit puberty or boys that have hit puberty. So far as they have hit puberty, you fall into that classification. Same for the women as well. Um, so yes, in PCOS, basically, okay, every woman, yeah, every woman has androgens and all of the other hormones. Every man also has estrogen and all of the other hormones. However, in men, the estrogen level is minute. When I say minute, I mean chickeny, very small, tiny, weeny, itty bit. Yes, in some it's even non-detectable, but it's usually there in many, very small. In women as well, there's androgens. Let me just use the word testosterone. But it's usually just small, very small compared to the other hormones that they have, like estrogen and progesterone. That's in certain quantities, larger quantities compared to testosterone. So for someone that has PCOS, it's possible that very possible that they would have high testosterone and then they will now have small estrogen, which is not normal. So causing that imbalance. So when we say hormonal imbalance, it could be the testosterone being high, or say testosterone is not that high, is normal as it should be, but that person has progesterone in amounts that they should not have, or estrogen in amounts that is not enough. That is just, I think, is a simple way to really explain hormonal imbalance. PCOS is a type of hormonal imbalance. So in someone with PCOS, the hormones are in disarray. They are not how they should be. That's what it is. As for me, right? Okay. Yes. For me, it was noted that my progesterone levels were very low, lower than it should be. And my estrogen levels were also a little lower than it should be. And my testosterone levels were very high than it should be. So that was the issue for me. Sorry, did I say the estrogen were a little lower? The estrogen was actually a little higher than it should be, and then progesterone were too low than normal. And then progesterone was too low, estrogen was a little higher than normal, and testosterone was also very high. When I use the word normal here, there's a range of values that's medically noted to be normal for women and for men as regards hormones. So I did some tests that showed that for me, my hormones were not in regular tandem as it should be. In addition to, the ultrasound that showed the ovarian cyst and engorged endometrium, endometrial hyperplasia. So my endometrium was engorged with blood that's supposed to have shed but did not shed. So it was inferred that I had not been ovulating for months, which was why, of course, I was also not menstruating. So, yes, we began to explore, okay, treatment options. First off, um, firstly, is that is firstly a word? It's not a correct word. First, um, my gynecologist at the time I was preparing for my SSC, was a senior school certificate examination. Basically, my high school final exams, and he said it would not be comfortable to commence treatment at that period. It would just make my stress levels higher. So we decided to wait until I completed my exams, which took a while, uh, a really long while. A lot of things happened during that period. I had to write exams over and over. I have no intention of divulging into those details, but yes, it took longer than I thought it would, longer than expected. So I did not go back to my next appointment until after a long while. And during this period of having not gone back, sometimes I see my period for the month, sometimes I do not. So we're just okay, hands crossed. Is it fingers crossed? Fingers crossed until I finally had time to make it to my next appointment. Although this sounds like a very short duration, mind you, from the first inception, from the very first time that I went to see that doctor until the time that I went to see another doctor, which is the one I stuck with, the consultant gynecologist, up till the time that I finished senior secondary school. It was a long time. Yes, right? So basically, it was after my second appointment that we decided to wait till I was done with my WASE exams, which means that between the first and second appointment, even though I said it was some months, I still had other appointments in between, which were checkup visits to just talk, not really to do any tests or discuss in details, right? We just talk during those little visits. And also, from the very first time I went to see that consultant gynecologist, he he told me to get a notebook, which was where I started putting details. So every month, the number of days that I menstruated for, the number of pads I used in total, that is number of pads I used every day until the end of my menses for that month, and whether it was painful or not, whether there was anything I noticed that was different or not. He told me to be noting it down. I think I still have that notebook. So yes, that was it. It continued like that. I finally finished my SSC exams and I went to see him. For anyone who's wondering, yes, all of this costed a lot of money. I remember very well the most costly things other than the hospital visits and time spent was the tests. Those hormonal tests, I know they costed a lot. I can't remember how much the abdominal ultrasound costed or how much all the tests, the hormonal assays test in total costed. But I knew it was costly. Um yes, we went to see him, myself and my mom, that is, after my finals. And again, bear in mind, by the time we went to see him after my finals, I had lost almost 10 kg. Yes. After my exams, again, I was quite stressed, I think, with the exams. And I was also trying to be consistent with working out, which was not really working out for me, but I tried. And so it was surprising what happened. I lost quite some weight, notable amount of weight actually. Not too much, but notable when I went to see him. again. So we then decided to commence treatment. Now, this is talking about my PCOS. I haven't gotten into that point where I really started having painful periods. When painful periods was a thing, I've not gotten to that part. I just want to give a layback, a layout, a foundation as to what prompted me to start having painful periods. What my life was before I started having painful periods. So any layman, anybody who doesn't know me, who doesn't understand anything firsthand before watching this video would grasp, would have an idea and trying to let people fit in my shoes and get what my life was, how it was moving, how it was going, and what major catalysts sprung up. The rising actions, basically, in details. Um, Treatment. Hmm, Another interesting one. We began to think what sort of treatment would work best, and then he settled and opted for. When I said he, I mean my gynecologist, and it's not just him. Of course, it's me, my mom. So we rather settled for OCPs, oral contraceptives. The gynecologist and my mom thought that was best. Again, a little by the way, my mom is a perioperative nurse, so she's quite medically inclined. So yes, oral contraceptives, and then the trial and error began. By the way, if you're someone who just buys an oral contraceptive because somebody else is using it and you think it should work for you, wow, you're lucky. I mean this in no disrespectful manner, but there are some of us that we have to try something to know whether our body accepts it or not. And I kind of fall into that category. Um, Generally, the consultant said he would give me a drug and ask me to. Generally, he said if he wants to prescribe a drug to treat the condition from which I was suffering, that he would give it to a patient and tell them to test it and then come back and see if there was any changes or any discomfort that was noted during the use of that drug to see if it needs to be changed or treatment can commence fully. And he did that with me as well. Gave me the first oral contraceptive, can't remember the name. I went home with it. I used it, and I was not okay. I think I started showing up the following day. Yeah, it was the second day, not long after I used it, I started throwing up. The first day I felt a bit fuzzy. My mom said it was anxiety. So the second day when I started throwing up, we're like, okay, this is certainly not for me. Again, at that time I was um I think about 14 years old when I started trying those oral contraceptives. So yes, I started trying oral contraceptives at 14 years old. Life. Yes. Used it. mm, Was not comfortable with it. Went back, right? So then we changed to another oral contraceptive. I used that one. So the issue with that one was that I had to take it judiciously than the first one. With the first one, I think there were days that I could skip, something like that. Well, the second one, I think it had to be every day, which I hated. And I had a big fight with my mom because I was frustrated and she was also angry at me. We ended up going back to the hospital, anyways. We changed to another oral contraceptive. Now, the one we changed to, my complaint was that my breast felt sour and heavier. By the way, I forgot to mention this. I also began to have along with puberty, one thing that I just grew was breasts. So as I started menstruating, my breasts started developing. When I resumed as S1, I remember that time it was like everyone was looking at me. 'Cause when I left for my GS3 holiday, my chest was flat. But when I resumed SS1, I was already wearing bra. So if you can imagine that, yes, my breast started growing. So when I complained to my mom about the sour breast, back to track that I was having with that third oral contraceptive that I was trying. She took me back immediately. She was freaked out. Apparently, I found out that we do have a few people in our lineage that had breast issues, and she was scared, you know. Even though the people in extended, like distant relatives, but she was still freaked out. Went to the doctor, my consultant gynecologist, and he then gave me another drug, Dufaston. Now, this was the drug that I used. So when he gave me this drug, he was like, "You should not have any issue with this one. We have changed and changed. This one must work. No complaints." And yes, I didn't have any complaints with that one, Dufaston. I can never forget the name of that drug. It's impossible. I used it. There was no complaint. Again, there was also one that I had to use judiciously, but who was I to complain? I accepted my fate. Other than the fact that I had to use it also judiciously, which is just a way of me saying I have to use it every damn time, which might not really sound much of a big deal to someone who is used to oral contraceptives. But telling a 14-year-old that take this kind of drug, you have to take this at this time, by this time, every day, it just, mm-mm. But I took that one. Okay, it was not actually every day. I think I took it for 14 days and then I took a 7 day break. And I took it for another four. I can't really remember. I think I can remember. Maybe I'm just too, maybe I just don't want to remember. But if I try, I could. So, yes, um, the first one was the one. That's the brand name of the drug. It's a progesterone synthetic, meaning that the work progesterone does in the body, that's the work that the drug will do in my body. So I'm taking it to increase the levels of my progesterone that were low. So that way, when my progesterone levels are increased to a certain height, it will balance up other hormones. And also, this progesterone tablet has a little of um I think was it androgen in it. The I can't really remember in details, but yes, simply put, I was taking the drug to balance my hormonal imbalance. So yes, I started, and that first month was okay. So we went back again, and I was like, okay, this is the one that we are going to stick with. So all the ones that I've been taking before were trial and errors. We had not done anything physically. Little did I know. Um, and then they said we are going to start. And then the next month, before my period, we then went there and then he gave me that drug. And oh, when I say he gave me, it's not like he dashed me. No, we're buying the drugs. Even all the past ones that were trial and errors. Yes, listeners, we're buying all of them. So yes, I went there and we bought the drug and I started using it. He said I was going to use it consistently, judiciously for 6 months. Start. The first month was just anxiety reading, and frustrating. I thought that was just the height of it. I was wrong. The second month was when the real drama began. I was bleeding crazily and I was in intense fatigue. I could not really fathom it. And then he said it was my endometrium. It was finally shedding all those engorged blood because I'm now using the tablet consistently that my body is adjusting gradually. So by the third month, the level at which I was bleeding heavily was insane. I was using about 6 to 7 pads in a day. My mom was really scared. She took me to see the doctor during my period, and I was like, "It's okay, it's okay." And by the fifth month, I think the AV bleeding stopped. And yes, it did stop. But then, around that time that the AV bleeding started, pain also started. I mean, pain in the sense that I would start menstruating, right? And I would be in immense pain. So yes, I was having really intense pain that I can't really describe. Indescribable level of pain. The kind of pain that will make you not be able to do anything, not be able to stand up from your bed and just be bedridden. The kind of pain that makes you not be able to even want to talk to anyone else. The kind of pain that makes it even hard for you to clean your own environment. That makes the only thing that you find worth cleaning be your own body. And even that, you have to build yourself up and brace yourself up to do it. That's the level of pain I'm talking about. Now, like I had said earlier during the beginning of this video, pain is subjective, right? So, yeah, a random person might look at this and be like, oh, ah, we all had pain, but we survived. Yes, okay, congratulations to you. Unfortunately, a lot of women are dealing with pathologies that they do not even know about. And when it comes to topics like this, menstruation in particular, they try to bring up comparison using pain as a bar to measure your accountability as a woman, or maybe you are less of a woman, which I find very pathetic. Just a little by the way. So, to anyone who is having unbearable amount of pain, I'm sorry, but I want to kindly say that is not normal. Maybe at a point in my life, I had also thought it was normal, but as I spoke more with my consultant gynecologist, I realized that even though pain is subjective and a certain amount of cramps and discomfort occurs during menstruation, it has boundaries. The kind of pain that alters your life activities, that alters your job, that threatens your sustenance, that makes it impossible to do anything, that kind of pain is not normal. regardless of what your definition of normal is. So yes, the pain started and we went to see him, and he said it was because actually we did another test at the time, and then he told me, the guy, gynecologist, that was because my body was now gradually adjusting to the hormone surges, and also I was now beginning to ovulate. It was intense. Now, as if that was not enough as a discovery, or should I say a revelation, the real ovulation thing, nan it, I think it was like the last month of using the fast one, like about 7 to 14 days after my period, I then started having these really crazy urges, intense horniness, which is again amusing when you like think about it. I don't know. Personally, I find it really amusing what the human body is capable of doing, especially a woman. Now, I'm not trying to make this a topic of gender discrimination in whatsoever manner. So, if anybody is trying to infer that, good luck to you and whatever thought you're having in your head. I'm just talking about me, myself, my story, and me being a woman. That's that about that. I said what I said. So yes, um, after 6 months, it was noted again that now my body has started ovulating normally, even though I was still having those intense cramps as at even my last period, which I related to my gynecologist when I went to see him. He said it was okay and I would be fine. And then the next menstruation I had, I also had that same pain. And when I mean pain, I don't know. It's pain that makes you cry, pain that makes you feel handicapped, pain that makes an introverted girl not care at all as to whether any of her male cousins see her crying or not. That was the level of pain that I don't that that I'm trying to describe. If it it's relatable to anyone. So yes, that was my experience with dysmenorrhea, and it did not end there. It continued for a while, for lesser than a year, even after my PCOS treatment. And I still continued having, of course, checkup visits. I know the funny thing with PCOS is there is no cure, just the major symptoms are being managed. Yes. So it can reoccur, it may not occur. It doesn't mean that every symptom you go to the doctor with will be cured, right? They manage the most important symptoms and try to find a remedy to manage it wholly, to make sure that the basic things that your body should be able to do, which it is not doing, should be remedied. Like me not ovulating, of course, after which I started ovulating, my endometrium not shedding the blood, which it eventually shed, right? That was dealt with. My progesterone levels, which was brought back to how it should be, roughly. But then I began to have pain, which I was told I might have to manage for a while as my body was adapting. Another thing that occurred that blew me off was at the time that I was having those treatments. whenever I went to the salon, my salonist usually said my hair. The first thing she said, which was weird, that threw me off, was that I had dandruff. Now, my mom is a very strict woman, somewhat, you know. I don't know why I used the word somewhat. She's strict. Um, we had our own combs, our own air creams. We do not share. So how did I get dandruff? I didn't know. I didn't believe her until she showed me. I was like, okay. And then she kept saying it back to back with every fellow follow up appointment that I had at the salon. She said my dandruff is getting more plenty. Meanwhile, after I told my mom the first time, she started getting anti dandruff shampoos and creams, which means it was supposed to be getting, alleviated. But she said my salonist said it kept getting worse. So the time, I just didn't really get why I just was suddenly having dandruff. I didn't make no correlation at all between dandruff and PCOS. So before you knew it, by the time that I was done with my treatment completely, I mean, that stopped taking the Faston, the drug completely after those 6 months, after all of my checkup visits to the clinic. By that time, the painful period still occurred, but the pain was waning with every period, meaning that it was reducing somewhat in intensity, but it was still there, right? So I'll just be hoping that, okay, with every month, the pain, just go away completely, which did not happen. But to some extent, it somewhat got better as the months passed by. As the months passed by, I went to my salonist again, you know, forward, fast forward. And there was this day she was like, I don't understand. Is there something you started doing that you're not doing before? This dandruff, despite everything you said you're doing about it, it's not going. And I didn't know what to do. And I went to and I felt like crying. I told my mom I was going to cut my hair. She begged me not to. Now, a little backup story, or should I say, side note, I had really long hair, extremely wild hair, the kind of hair that you see on models in TV. Although I have no interest in showing my hair in this video, I'm just trying to give an idea. I had really long, wild, full hair. So, as at the time that I'd stopped PCOS medications, whenever I went to comb my hair, I would note that it falls off and breaks very easily. And out of curiosity, I started typing in Google, why will somebody's hair start breaking and all of that? And when my salonist asked that day if there was something that I did differently, I didn't tell my mom when I got home, but I just went again to my phone. My mom's phone actually was what I was using, and typed, can PCOS cause somebody's hair to have dandruff and be breaking? And then I started seeing articles, and somehow I started getting drawn to them. And I think that was where my love for research got born. But yes, today I love doing research, really love doing research. And yes, I started reading articles, reading publications as to how PCOS could affect a person other than biologically with their, female organs and hormones in terms of the whole body. And another funny thing that I found out, which is a side note again, was the correlation between weight gain slash loss and PCOS. Until today, I still don't know the correct theory. Some say obesity causes PCOS. Others say gets PCOS has a higher risk of occurrence in people who are obese, right? Which is the former thing that I said. While some article says, mm, what have I just said? Okay, some say people that are fat can have PCOS. Some say PCOS happens as a result of someone being fat. Meaning that some people are saying, oh, if you have PCOS, you'll be fat. PCOS causes fatness can cause PCOS. And others are like, no, it's not the fatness that causes the PCOS, it's the PCOS that causes the fatness. And it was while reading this relatability that I then came across diabetes, insulin resistance. It's at the middle of this argument of PCOS and being overweight. So the weight loss or weight gain occurs as a result of insulin resistance. So now the main hypothesis is whether insulin resistance occur due to PCOS or if PCOS stems from insulin resistance. I don't know. Nobody knows. From what I've seen on the net, they're just hypotheses, studies, but nobody knows. So yes, feel free to research and check and understand what I'm saying in details. Today, my periods are normal. Now, my normal is not as painful as it used to be when I was taking the first turn for those harrowing 6 months. But I do wish it was the way it was when I started menstruating, when it did not hurt at all. But it has never gone back to that. It still hurts today, but not as much as it does for those harrowing 6 months. Meaning the pain that I do have now when I'm menstruating is bearable, but there's still cramps, there's discomfort, and I've grown to learn to live with it and walk through it, and also deal with my ovulation discomfort as well, which mostly stems from the horniness, which is that surge in hormones again that occurs during that period. So, to everyone out there, I hope you grow to really appreciate your body and respect it and listen to it and allow it to do its thing while just being kind to it and being kind to yourself. It took years for me to get to this level where I've grown to understand my body and listen to it. I'm at a stage where just by sitting down, by certain feelings that I have after I've been probably bickering for a while in, let's say, 2 days in a row, it just suddenly occurs to me that like my period is coming in a few days. The way that I've been acting lately, I no longer keep record of my period in a notebook, but I can tell when it will soon be here, even if I don't remember the date of when it occurred the last month. And I can also tell the same with my ovulation as to when I'm ovulating and when I'm not, which might sound silly to a random woman watching this. What do you mean you know when you're ovulating? Well, years of harrowing of harrowing treatment. Of course, I did harrowing treatment for just 6 months, but it took my body more than those 6 months to fully conform with all the changes that occurred in it. So, the basic emphasis I'm trying to make is as regards to the main topic that is being discussed, painful periods. Pain is subjective once again, but the type of pain that makes you not able to do anything and alters with your life activities is not normal, no matter what your definition of normal is. So please, if you experience that level of pain, kindly see a professional. And by a professional, I mean a gynecologist. I hope this has helped someone and made them more comfortable with their bodies and made them and make them to be willing to want to know more about their body and listen to their body and respect their body. You don't have to go out to know more about your body or be unkind to yourself to know more about your body, but just simple things like eating well, actively working out. Now, I do not work out actively. I don't like to think of what I do as active working out. My favorite thing to do is to take long walks as exercise, which might seem silly to some people, to each his own. But for me, that works and that is enough because I've grown to understand that small but consistent effort goes a long way and is even more productive and rewarding than big efforts that are inconsistent. Once again, my name is Azima, and I hope this video has helped someone in realizing that even though painful periods are somewhat normal to an extent, there is boundaries, and outside this boundary is a rule, or should I say, an unspoken guideline that whatever level of pain that alters your normal like activities, that is the kind of pain that makes you not be able to do anything at all, is not normal. You should see a professional. There is certainly something behind it. You might not know, and maybe people before you have conformed to it and made you believe it's normal. Maybe the society you live in has told you that it's normal, but nobody has the right to tell you what is normal with your own body other than yourself. You should know if it's bearable for you or unbearable. So when it becomes unbearable, you should know that it's not normal. And so you should seek help and sought for assistance from a professional, a gynecologist, to put you through and then tell you the cause of that pathology or why you are experiencing that unbearable pain. Thank you very much once again.